Hello, this is Dr. Mary Rensel. We are going to review a few updated abstracts from the recent meeting CMSC in Indianapolis, Indiana. The focus is going to be on what's new in MRI imaging for multiple sclerosis. The first paper we look at is Dr. Repovic. It's entitled Disease Activity During the First Year Predicts Clinical Long-Term Outcomes in Patients with Multiple Sclerosis, Fingolimod Treatment Benefit. In this study, they looked at early MRI activity and relapses in transforms to see if these were predictive of MS outcomes. To assess clinical outcomes of these patients, switching from interferon beta-1a to fingolimod, and they were followed in an extension study. Transforms is a phase 3 study of fingolimod. It's double-blind, randomized study followed in an extension study for 36 months. Both the MRI activity and the relapses in the first year predicted long-term outcomes such as disability progression at 1, 2, and 4 years. Switching from interferon beta-1a to fingolimod after 12 months reduced the MRI activity and the relapses. Practical clinical takeaway points from this abstract show that MRI activity can be defined as greater than 1 GAD-enhancing lesion and greater than 2 new T2 lesions. And when the MRI shows activity in the first year of MS therapy, one should consider changing the MS therapy, as this can then predict more relapses and possible disease progression of neurologic deficits in 1 to 4 years, as shown in this study. The next abstract was reviewed is Dr. Trabulsi's Durable Effect of Alemtuzumab on MRI Activity and Brain Atrophy in Relapsing Remitting MS Patients. It's a 4-year follow-up of the group in CARE MS2. 89% of the patients were free of GAD-enhancing lesions. 70% were free of new or enlarging T2 lesions. 86 were free of new T1 lesions. And most patients were MRI activity-free at year 4, 69% despite the majority of patients having only 2 doses in 4 years. The median rate of brain parenchymal fraction loss progressively slowed over 3 years and remained low in year 4 after receiving the Alemtuzumab. Some takeaway points from this study show that Alemtuzumab may only need to be dosed 2 times in 4 years, depending on the clinical and MRI activity of the patient. Alemtuzumab stabilized the majority of the patient's MS activity on the MRI, lasting 4 years. And the slowing of the brain volume loss was maintained over 4 years. The next abstract is Dr. Gagne's. It's entitled 1 in 10,000 is not 0. Lessons learned from a Natalizumab-related PML case with repeated negative anti-JC virus antibody testing. MRI assessment in those on Natalizumab can show white matter changes that are diagnostic of a brain infection called PML. Natalizumab itself is associated with this brain infection and increases the risk of having PML. PML is associated with a mortality rate of 22%. PML is also known as progressive multifocal leukoencephalopathy. In this study, they describe a case of Natalizumab-associated PML where the anti-JC index was negative 2 weeks prior to new onset symptoms. This was a 70-year-old woman treated with Natalizumab for 4.5 years, and she had sudden onset of right-hand weakness, and her blood test was negative for the JC index 2 weeks prior to the onset of her symptoms. Takeaway points from this case show that Natalizumab-related PML can indeed occur with negative anti-JC antibody testing. Natalizumab-treated patients with new onset symptoms should be evaluated for possible PML with an updated brain MRI if the anti-JC antibody test is negative or positive. And the anti-JC index blood test, updated brain MRI, and spinal fluid JC PCR should be tested if there is a clinical suspicion of PML. The last study is entitled Diffusion Tensor Imaging, or DTI, of the cortical spinal tracts and walking outcomes in MS. DTI reflects restrictions to diffusion and quantifies disruptions and damage to the white matter tracts along the cortical spinal tracts of the spinal cord. This study examines the association among the DTI indices of the cortical spinal tract with walking and gait outcomes. 58 MS patients underwent a 3 Tesla MRI of the spinal cord looking at the cortical spinal tracts and had their walking assessed. The white matter structural integrity of the cortical spinal tracts in the brain and the spinal cord were examined. The motor pathways were identified and damage was noted in 2 measures, the radial and axial diffusivity. Some takeaway points from this study show that MRI techniques, termed DTI, can help to document the damage to motor pathways that lead to walking and gait outcomes in multiple sclerosis. And this indeed may be new MRI techniques that will help to highlight the pathology affecting the walking performance in MS patients. Thank you for your time today.